Hi everyone, my name is Carissa Murray. I am going to be talking about how to place in a Foley catheter. The first steps that you want to do is your implementation steps. You want to make sure that you go into the patient's chart to make sure that you have the right patient. You want to also do the donning of your PPE and the cleaning of your hands before entering into the patient's room. You want to also gather all the necessary supplies. Insertion kit, you want to grab an extra pair of sterile gloves. You want to grab your catheter leg strap, the bath blanket for the draping the patient. You want to grab your flashlight or procedure lamp and any extra store catheter in the same size, just in case something might happen. You want to follow the initial implementation steps. You want to provide peritoneal care as needed. You want to position patient appropriately. For female patients, you want to make sure the knees are flexed and the feet are as far apart as possible. You For the male patient, you want to do the same, or you can have the male patient lie flat with the legs close together. When opening the catheter kit, you want to position the catheterization tray appropriately for a male or female patient. You want to open the wrap correctly and set up the sterile field. You want to don the sterile gloves and prepare the sterile supplies. You want to drape the patient with sterile drapes and lubricate the first several inches of the catheter before placing. You want to clean the urinary meatus for the female. You want to clean the far side, then the near side, then down the middle over the meatus. For the male, you want to clean the gland penis in a circular motion from the meatus outward and down the shaft. While holding the labia open for the female, or the penis at a 90-degree angle for the male, you want to insert the catheter into the urethra. For a female, insert approximately 2 to 3 inches. For the male, you want to insert approximately 7 to 9 inches until the urine starts to flow through the tubing. Then insert another 1 to 2 inches. You want to inflate the balloon to ensure that it is seated at the vesicourethral junction. You want to make sure this is in place, or the catheter can possibly come out if the balloon is not ballooned. You want to secure the catheter tubing to the inner thigh with a catheter strap or tape. You want to hang the drainage bag on an appropriate part of the bed to prevent it from being raised above the level of the bladder. You want to follow the ending steps, and you want to document the procedure and the patient's response. You want to, while you're documenting, you want to make sure that you put the date, the time, and your name and your credentials as you are signing off. Thank you.